Hi, my name is Monica. I'm one of the nurse practitioner students, and I'll be doing your physical assessments today. I'm going to just start by palpating your head, examining your head, looking for any lumps or bumps, feeling for any lumps or bumps. Okay, I don't feel any. Next, I'm going to just assess your face for symmetry, looking for any lesions. I don't see any lesions. Now I'm just going to palpate for your temporal pulses. They are present and they are strong. Now I'm going to just assess your cranial nerves. So I'm going to have you just make a few faces. Raise your eyebrows, close your eyes, give me a big smile, frown, puff out your cheeks. Okay, very good. Now I'm just going to feel for your TMJ. If you just give me a few, open your mouth and close them, feeling for any pops or clicks. I don't feel any pops or clicks. Now I'm going to test your facial sensation. I'm going to have you just close your eyes, and whenever you feel this cotton ball in your face, just say now.
No, no, no.
Very good. So now I'm going to move on to your eyes. First, I'm going to look at the outer structure of your eyes. Make sure that they're symmetrical, no lesions or anything around the eye. Just going to look at your sclera and conjunctiva. They're white and it's pink. Okay, no discoloration there. And I'm going to just test your accommodation, convergence, and EOM. So I'm going to have you just follow my finger. Checking for any nystagmus, checking the eye movements and tracking of the eyes. Good. And then convergence. Okay, very good. Now I'm going to just check for direct and consensual reflex. I'm going to just dim the lights. I'm going to have you just look right behind me. Checking for a direct reflex. Good. And then consensual reflex. Very good. Do the same thing on the other side. Look straight ahead behind me. Looking for direct and consensual. Very good. Now I'm going to look behind your eye, or the inner structures of your eye, checking for blood vessels, red light reflex, macula, and fovea. So I'm going to have you just look again right behind me. Just going to lift your eyes a little bit. Okay, I'm just going to shine a light in you. Looking for the red light reflex, distant cup. Looking for the fovea and the macula. Okay, same thing on this side. Look straight behind me. Okay, checking for red light reflex, distant cup, blood vessels, fovea and macula. Very good. Okay. I'm going to turn the lights back on. Now I'm going to just palpate your ears. Do you feel any pain or discomfort?
No.
Okay, so now we're going to do the whisper test. You just repeat after me.
Red, white, blue.
Okay, and then the same on this side.
Cat, mouse, dog.
Good. Now I'm going to check the inner structures of your ear. Just going to pull the pin up, back, out, and up. Okay, looking for the tympanic membrane. It's good. Pearly and white. Sorry, pearly and gray. Same thing here. Out, back, and up. Okay, tympanic membrane is pearly and gray. Okay. Now I'm going to just assess your nose. First, I'm going to just inspect the outer structures of the nose. There are no deviations. Septum is in line. We're going to do the sniff test to check for patency. If you want to just cover one nostril and sniff in. Good. Now do the other side. Okay, nose is patent. Bless you.
Thanks.
Now I'm going to check the inner structures of your nose. Good. Okay, I see the turbinates. No polyps present. Same on the other side. Okay, you see the turbinates and no polyps present.
Tickles.
Yeah. Okay, now I'm gonna just assess your gums, your teeth, and your mouth basically. Okay, looking your teeth, checking your gums. Good. Now open your mouth. Okay, checking the buccal mucosa, the hard and soft palate, the tongue underneath the tongue. Can you lift your tongue up? Good. I don't see anything stick out your tongue. Gonna check the back. I'm gonna just gag you. Okay, very good. Now I'm gonna move on to your neck. I'm assessing the neck for any, no, actually I'm gonna palpate your lymph nodes. Okay, so I'm gonna start off here. So preauricular, postauricular, checking for any nodules, then occipital lymph node, moving back to posterior cervical lymph node, going down, back up to submandibular, submental, then back to anterior cervical, to the supraclavicular lymph node. Okay, I don't feel any nodules there. And then I'm just gonna have you resist against my push with your shoulders. Can you lift your shoulders up and resist? Okay, very good. Now I'm gonna assess your neck. Okay, I'm gonna just look at the neck. I'm looking at the trachea, it's midline, no deviation. I don't see any goiter present. Now I'm gonna just assess your, what am I assessing? Thyroid. Now I'm gonna assess your thyroid. Okay. So I'm gonna have you take a sip of water, but just keep it in your mouth. Don't swallow till I tell you to. So I'm gonna just palpate for the Adam's apple, and I feel the ridge. Then I'm gonna go lateral. I'm gonna have you lean forward and to one side, and then swallow. Okay, I don't feel any nodules there, and we'll do the same thing on the other side. You take another sip. Good. Same thing, gonna palpate for the Adam's apple, feel the ridge, go lateral, forward, and now that side, and then swallow. Okay, I don't feel any nodule. Okay. Okay, now I'm gonna listen to your lungs. I am going to just examine your chest, looking for any lesions, scars. I don't see any. The AP diameter is 2 to 1, as it should be. I am going to first percuss. You just breathe normal. I'm just gonna percuss down your lungs. Feeling for any consolidation. Okay, I'm gonna do the same on your back, and you just breathe normal. Okay. And next, I'm just gonna auscultate your lungs with the diaphragm. You just take a deep breath every time you feel the stethoscope move. Same thing on the back. Okay, good. All right, now I'm gonna just palpate for your carotid pulses. Okay, present. Okay, present. Now I'm gonna just listen with the bell. I'm gonna have you take a deep breath. Take a deep breath and hold it. Okay, good. Do the same thing on this side. Take a deep breath. Okay, good. I'm gonna just examine your chest. I don't see any. I'm gonna have you lean forward and just not that far, just a little bit. Checking for any pulsations or heaves. I don't see any present. And I'm gonna just listen to your heart with both the diaphragm and the bell. And I'm gonna have you do it sitting up and supine. Okay, I'm gonna just listen at the aortic, then pulmonic, Erb's point, tricuspid, and then mitral point. Do the same thing with the bell side, aortic, pulmonic, Erb's point, tricuspid, then mitral. Okay, very good. Now I'm gonna just have you lay down. Do the same thing with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. Using the bell side, same thing, aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, you can sit up now. Actually, no, you can lay stay laying there. Okay, now I'm gonna move on to your abdominal assessment. I'm just gonna first inspect. I'm gonna look for any lesions. I don't see any. Everything looks normal. And I'm gonna start by percussing. No, I'm gonna start by auscultating first. I'm gonna listen to all 4 quadrants of the abdomen with the diaphragm. Okay. I'm gonna percuss all 4 quadrants. I'm gonna try to palpate for the liver border. Not palpate, percuss. Okay, it's right there. So from there, I'm gonna have you take a deep breath and I'm gonna try to palpate for the liver. Take a deep breath again. And then exhale. Okay, I'm gonna do the hook, feeling for the liver. Okay. And then now I'm gonna just palpate all 4 quadrants. Any pain or discomfort?
No.
Okay, good. You can sit back up. Now I'm just gonna look at your extremities, checking for your peripheral vascular, checking the temperature, looking for any edema, looking at your fingernails, checking the capillary refill. Normal capillary refill. Good. Now I'm gonna just palpate for your brachial pulse. Okay, and then radial. Okay, present. Now I'm gonna, can you take off your socks, please?
Mm-hmm.
Same thing, looking at the lower extremities, checking for temperature, checking for edema, any swelling, no edema present. I'm just gonna have you lay down. I'm gonna check for capillary refill. I don't know if they can see it. Checking for capillary refill. Good. Let me see the other side. Okay. Good capillary refill. Now I'm just gonna palpate for your femoral pulse. You want to scoot back up a little because then I'm going to have you raise this leg a 30-degree angle, and I'm going to just like that check for your popliteal. Oh, okay. Now this one. Okay. Put it up. Just put it up. Both. Okay. They're going to check for dorsalis pedis pulse. And then the tibial pulse. Oh, both present. Okay, and that's it. Thank you.
Thanks, Doc.